Hello, Theo, Mr. and Mrs. Turner. I'm Miss Larkin.
And I'm Miss Parvez.
And we heard that you were just recently diagnosed with Klinefelter syndrome, so we wanted to go over with you how this syndrome might affect Theo's life and maybe some ways to even alleviate these symptoms. So first of all, I wanted to give you these two handouts that Miss Parvez and I made, because then you don't have to take any notes during the consultation and you'll be able to take these home.
Just a quick description of Klinefelter syndrome is that it's a genetic condition that causes a male to be born with an extra X chromosome, XXY trisomy. This condition is not inherited, but is a result of a random biological event during fertilization. This syndrome only affects males, and it usually isn't diagnosed until the male has reached adulthood, but in this case, it's different.
So, if you were diagnosed through a physical exam where they looked in your private parts and on your chest, you may want to go get hormone testing done and chromosomal analysis, because this will confirm the diagnosis. But since you're already diagnosed, we just didn't know how you were.
And so, as some symptoms, as a baby, signs may include weak muscles, slow motor development, delay in speaking, and some possible problems at birth. And then after toddler stages to up to adulthood, there's a little bit more signs, and they can be taller than average stature, long legs, shorter torso, broader hips, or there can be absent or delayed or incomplete puberty during around their ages of puberty, like 12 to 15. After puberty, one will not develop as much muscle mass, and they will grow less and less facial and body hair, small and firm testicles, enlarged breast tissues, weak bones, low energy levels, and difficulty expressing emotions. And then some other things are problems with cognitive skills like learning, reading, doing math, and then a low sex drive, increased belly fat, and a low sperm count or no sperm at all.
So that's the description of the disease and how it manifests itself. But there are several treatment options, but we want to stress that, number one, these are completely optional. Klinefelter syndrome, it's not inherited, and it does not affect the life expectancy in any way. It's only if you want to decrease the intensity of some of these manifestations of the disease. And number two, we want to stress is that there's no absolute cure for Klinefelter syndrome. You can only treat the symptoms. There's no way to repair the chromosomal abnormalities that it causes. So some of the treatment options that you may or may not want to do to minimize the effects of Klinefelter syndrome are testosterone replacement therapy. During the time of the onset of puberty, testosterone replacement therapy can be given to help stimulate the changes that normally occur during puberty. So that would give Theo, if he doesn't have some, because Klinefelter syndrome is a spectrum, he would have facial hair with testosterone replacement therapy, he would develop a deeper voice, and he would have increased muscle mass, and when he gets to the age, he would get an increased sex drive. But testosterone replacement therapy does not improve infertility. We also need to stress that. That's a whole nother treatment. And also, testosterone replacement therapy can increase bone density to reduce the risk of fractures in Theo. Another one Theo might want to consider, or might not, is breast tissue removal. So in males who have Klinefelter syndrome, who get enlarged breasts, you can actually just surgically cut out some of the tissue to make the chest more normal looking. And then Theo doesn't seem to have any speech or physical symptoms so far, but he may develop them later on, or I may just not be aware of them. But speech and physical therapy can also really help alleviate these symptoms. And as mentioned before, Theo does have a learning disability, and we are aware of that. So educational elevation and support can be used on your call, because it's completely up to Theo's needs. But it can be used to help alleviate some of these problems with his social anxiety and learning disability. And then lastly, when he gets older, he may want to consider fertility treatment if he wants children. So, however, it does depend on whether Theo produces no sperm or little sperm. Fertility treatment will only work if he produces just a little sperm at all. If he doesn't produce any sperm, there's no chance that Theo can have a child that he created of his own. So fertility treatment that we are interested in is called intracytoplasmic sperm injection, and it's basically where sperm is removed from the testicle with a biopsy needle, and then it will be injected directly into the egg. So that's just something Theo may want to consider when he gets older, and maybe he wants to have a kid one day.
And just some frequently asked questions that we normally get is, can men with Klinefelter syndrome have kids? And the answer is no. Klinefelter syndrome leads to infertility due to the LERM or no sperm production, as Piper mentioned earlier. However, there are fertility treatments that can be taken, in order to possibly father a child one day. Another question is, does Klinefelter syndrome progress over time? And the symptoms of Klinefelter syndrome stay constant throughout a patient's life, and the lifespan of a patient is normal, so it does not progress over time. And is Klinefelter syndrome genetic? And the answer is no, it is not an inherited condition. It is just you were born with an extra sex chromosome. And another last question that we've been normally asked is that, are there any identified risk factors that contribute to Klinefelter syndrome? And we said that Klinefelter syndrome stems from a random genetic event. The risk of this syndrome isn't increased by anything anything a parent does or doesn't do.
Okay, thank you so much for meeting with us today. We hope to have a follow-up with you next month. Bye,
Bye.
Theo.
Thank you.